The Chief Health Officer has provided a detailed report to the ACT Government that shows that the lockdown is proving to be very effective. We have reduced what is known as the effective reproduction rate to less than 1. This means that across the community, each person who is infected with the virus is infecting less than one other person. This is absolutely essential to continue in order to reduce the outbreak. By way of comparison, Sydney's effective reproduction rate is above 1, and that is why their case numbers continue to grow. Now, today's headline case numbers show that we are bending the curve down and are getting on top of the outbreak. However, it is a slow process and it will take more time. We still have unlinked cases in the community, and we still have cases who are infectious in the community. So as a result, our lockdown needs to extend until midnight, Friday the 17th of September. So we're asking Canberrans to continue to stay at home and to minimise close contact with others outside of your household to reduce the transmission potential of the virus. Now, as part of the extension of the lockdown, the Chief Health Officer has assessed the situation and recommended some further minor amendments to the public health directions to commence from 5 p.m. on Thursday, the 2nd of September. This includes doubling the outdoor exercise and recreation time to 2 hours each day, to give allowance for people who work predominantly outdoors, such as gardeners and landscapers, to return to work under COVID-safe requirements, and allowing a few more people to attend what will still be very small funerals and weddings. In relation to the construction sector, the partial reopening of the sector was outlined last week, and this will commence under stringent COVID-safe requirements this Friday. These requirements are going to be actively enforced by WorkSafe ACT and ACT policing. The government will continue detailed work this week with industry stakeholders on the necessary strict COVID-safe requirements that would allow other parts of the construction sector, such as the residential construction sector, to recommence from 10 September, subject to the public health situation not deteriorating between now and then. With the extension of the lockdown, we have again worked really well and collaboratively with the Commonwealth Treasurer's Office to expand the COVID-19 business support grants. So thank you to Treasurer Frydenberg and his team for that close and effective collaboration. We're able to announce that one-off grants will be significantly increased to a maximum of $20,000 for employing businesses and $7,500 for non-employing businesses eligible under the scheme. Any business that has already made an application does not need to make a new application. The new amounts will be automatically applied if you are eligible. The first payments will be made in the coming days. The Commonwealth has also confirmed that the COVID-19 disaster payments available through Services Australia will continue to remain available to Canberrans who have lost income during this lockdown period, subject to the Commonwealth's eligibility criteria being that the Commonwealth Chief Medical Officer extends the declaration of the ACT as a COVID-19 hotspot. So once again, I thank the Commonwealth Treasurer's Office for their engagement. Beyond financial support, we are also developing COVID-safe plans to allow more retail businesses to operate under a click and collect model during this extended lockdown period. There will be more information on this in the coming week. Turning now to schooling. With the extension of the lockdown, online learning will continue for the rest of Term 3. Term 4 arrangements will be determined in due course based on the advice of the Chief Health Officer and will be communicated with the community during the first week of the school holidays. Looking at vaccination. Today we will cross 66% of 16 plus ACT residents with a first dose of a vaccine, and 42% of 16 plus fully vaccinated. The numbers for 12 plus will be a few percentage points lower than both of those headline figures. Bookings for 16 to 29-year-olds to access a Pfizer vaccine at an ACT government clinic will open soon. So if you are in this age cohort and you want to wait for a Pfizer vaccine, then please register on our My Digital Health Record system today so that you are able to easily make your appointment online when those bookings open very soon. Of course, if you wish to receive a vaccine sooner than can be offered through the ACT government clinics, then AstraZeneca is more readily available through GPs and pharmacies, and you can get an AstraZeneca vaccine today. Now, currently, with just a little over 40% of the Territory's population over the age of 12 with 2 doses of the COVID vaccine, there remain a lot of Canberrans at risk of serious and life-threatening illness. So the priority for the ACT government over the next few months is to vaccinate as many Canberrans as possible, as quickly as possible, and to minimise the spread of the virus through sensible public health safety measures and effective testing, tracing, isolation and quarantine. It is the combination of these 3 approaches: vaccination, public health safety measures and what's known as TTIQ that will assist us to protect our community through this difficult spring period. So in summary, for those who have joined late, 13 new cases, 7 are linked, 6 still under investigation. At least 8 of the 13 were infectious in the community unknowingly for part of their infectious period. 13 people are hospitalised and 3 remain in intensive care. And again, we send our love and thoughts to the family and families of those in intensive care, and our thanks to the amazing staff in the intensive care unit at Canberra Hospital who are providing such wonderful care and support for these people. I'll now invite the Chief Health Officer, Dr. Karen Coleman, to provide further information on the new cases and the epidemiology of the outbreak. Following Dr. Coleman's update, myself, Dr. Coleman and the Minister for Health, Rachel Stephen-Smith, will be available to take questions. Thank you.
Good morning, everyone, and thank you very much, Chief Minister. I'm Karen Coleman, the ACT Chief Health Officer, and as the Chief Minister has said, since our update yesterday, we have recorded 13 new COVID-19 cases, which brings our total cases for this outbreak to 274. The good news is that a total of 32 of our cases for this outbreak have now recovered. That's an additional 7 from yesterday. But that still leaves us with 242 active cases currently. Of the new cases today, I can confirm that out of the 13, 7 can be linked to known clusters or cases. We know that all 7 of these are either household or close contacts, but the remaining 6 are still under investigation. Out of the 13, only 4 were in quarantine during their whole infectious period and therefore posing no risk to the community. Out of the remaining 9, 8 were infectious in the community for at least part of their infectious period, and one of these we're still conducting our investigations into how long they were infectious in the community. And as the Chief has indicated, as of this morning we have 13 people in our hospital, 3 of these in ICU with 1 person being ventilated. Since our last update, we have just over 700 self-identified close contacts and 3,600 casual contacts. and we have over 200 current exposure locations dispersed across Canberra. So again, no matter where you live in Canberra, it's very important to keep up to date with the list of exposure locations on the ACT COVID-19 website. To provide you an update on Ainslie Village, which I mentioned briefly yesterday, I can confirm today that we have a total of 3 cases linked to this site. This is regarding the confirmed case that I discussed yesterday, visiting Ainslie Village while unknowingly infectious, and 2 subsequent cases. Our multi-agency team, along with our non-government community partners, have and will continue to communicate directly with those affected and remain on site to continue to provide those affected with the wraparound support that they need. So I'm now just going to talk a little bit about our current position in general to back up the conversation that the Chief has just had. So as the Chief has said, our lockdown has been very effective actually at reducing the spread of the virus. And this is because overwhelmingly you guys, Canberrans, have been and continue to do the right thing. We know it's working because our numbers show us that, and it's why we need to continue doing it for a little bit longer. We do still have a number of cases with an unknown source and likely ongoing chains of transmission. When we have a look at our overall case numbers, of our 274 total cases since the start of this outbreak, we are confident that 245 of those are linked to either known cases or clusters. Excuse me. But this means that there continues to be cases with an unconfirmed source, and some of these are recent new cases which are under early investigation, but some of these go back a little further. So we currently have 29 cases in this category, so that you don't have to do the maths. 23 of those are from a little bit before, and we're unsure whether we will actually establish links for those, but 6 are still quite early in their investigation. And additionally, the proportion of cases has risen the proportion of cases which have been at least partially infectious in the community has also risen slightly over the last week. We actually need to monitor these 2 aspects of our outbreak very closely moving forward. As I have said previously, any ongoing chains of transmission or cases with an unconfirmed source contributes to increased risk to our community. So considering this, and in addition to the continuing situation in New South Wales, which surrounds us, and several clusters that we've talked about in our vulnerable and high-risk settings, the best decision that I think we can make is to extend the lockdown for another 2 weeks to help keep the ACT safe. Look, I know that this has been a difficult time, and in this case I think the end is going to be harder than the beginning. But I can assure you that this decision wasn't taken lightly. We know that the coronavirus, and in particularly the Delta strain, spreads very quickly and rapidly through the community. And we know that there are 3 main things that we can do to reduce that spread. The first is our public health actions. The Chief mentioned TTIQ. This is test, trace, isolate and quarantine. These remain vital to our approach, and we will continue to do all we can to maximise our impact in that space. The second of these is our public health social measures, or our community restrictions, our lockdowns. This goes to reducing our risk of spread by just reducing the movement of people, and we've talked about that quite a bit. And the third one is the big ticket item at the moment is vaccinations. The combination of these 3 areas all contribute to our overall aim of reducing the transmission potential or the effective reproduction rate of the virus in our community. And this is why we are all, including our Chief Minister, constantly speak so often about the importance of achieving over 80% vaccination coverage, and we are well on our way to getting there. But the balancing of these 3 things is challenging, and we may need to continue to adapt these as we move forward to stay on track and maintain our lowest transmission potential while having the minimest impact on you, the community. This is what I think the Chief is referring to when he's talking about it being quite a challenging spring and a challenging several months ahead of us. Until we get to that vaccination coverage, the lever that we have to assist us in reducing that risk of spread is very much our community restrictions. I'm conscious that being in lockdown, though, is challenging both physically and mentally, and that is why, along with the extension of the lockdown, we are making some small amendments to the health direction to allow for more outdoor activity and slightly bigger groups in some situations. I really encourage you to take advantage of those, but please do so in a really safe way. It is important to remember that we are still in lockdown and we need you to minimise your time in the community and really only leave home for those essential reasons. Really reduce the number of interactions you have with people outside of your household. Thank you to all Canberrans that have and will continue to do the right thing to help us stop the spread of COVID-19 across the community. So today, in light of this decision, my shout out goes to each and every one of you out there who has helped put us in this really good position at this point in time, and I'm just asking you, come with us for a little bit longer. I know we can get there, we just need to do it for a little bit longer. Thank you, and I'll hand back to the Chief for questions.
Thank you, Dr. Coleman. We'll now take questions. Start on this side of the room.
Chief Minister, if you don't think the 70% vaccination target is particularly meaningful in the National Plan, will you be lobbying National Cabinet on Friday to amend the National Plan away from that target?
No, I think the National Plan talks about at the 70% rate continuing to minimise cases in the community through ongoing low-level restrictions and effective track and trace, and says that lockdowns are less likely but still possible, and that the objective is to seek to minimise serious illness, hospitalisation and fatality as a result of COVID-19, keeping low-level restrictions in place. We have talked a lot about the three effective measures we have to combat the virus. Vaccination is a very significant one. It's the most effective thing we can do. But the two others are the test, trace, isolate and quarantine component of our response, and then the third is the public health safety measures. Now, the National Plan talks about a very gentle step at 70%. A more significant step would be taken at 80%. Now, as I've outlined here, based on the ACT's vaccination rates, by the time the nation reaches 70%, based on our current trends, the ACT would be at 80%, and by the time the nation reaches 80%, the ACT would be closer to 90%. Now, again, the National Plan is very clear that in order to move to the next stage in that plan, both the national position and the individual jurisdiction must both be above the threshold. So it's a little bit academic for the ACT at 70% because we're going to be at 80 by the time the nation reaches 70. But I have higher aspirations for protecting our community than just 80% based on what we've seen already from the age cohorts who've had access to vaccination. So the higher the vaccination rate we achieve, the more protected our community is and the less we have to rely on TTIQ and public health safety measures. So the higher the national vaccination rate is, the less we have to rely on those other two measures. So what we need is more Australians to get vaccinated more quickly. And we're seeing that in New South Wales and we're seeing it in the ACT, and I hope we see it across the nation.
Chief Minister, you've announced some further freedoms for us to gather outdoors, very welcome. In terms of the Territory's sporting leagues though, is this effectively an end to their seasons?
Well, it's going to be difficult for the next few weeks. There'll be no community sport. So I fear that it's going to be very challenging to complete winter sport seasons unless the summer sports are able to start a little bit later to accommodate some end-of-season activities.
And with the region's national parks, are you looking to reopen those?
Not at this stage, but down the track, yes.
Chief Minister, just on that new rule that 5 people can now gather outdoors, are you encouraging people to make a bubble so that it's the same 5 people that they're gathering with, or are you leaving that open for interpretation at this point?
Look, let's go back to first principles here. The virus transmits when people come into close contact with each other. You are in close contact with your household. If you have a bubble buddy, you're in close contact with them. So they would be the obvious people to be included, but it would allow for a few more people, but no more than 5, unless your household is bigger than 5, to come into contact with each other. So again, you ask people, and we are asking people to use their common sense here, that this is not an opportunity to throw a party, but it is an opportunity that, maybe the person that you're exercising with can be someone different. But again, don't expose yourself or your household or your family to unnecessary risk. What we know very clearly is that when one person brings it back into a household, every unvaccinated person in that household is going to get infected. So we certainly don't want your Father's Day gift to your dad to be a COVID party. You don't want that.
Chief, in terms of small business, when will rent assistance or commercial support be advised?
Tomorrow.
And how much is economic risk a part of your management decision making, or is it solely about health identified risk?
Well, health risk is the most significant component of our assessment. I don't think I'm going to put an exact percentage on it, but it clearly is very significant because all of the evidence, all of the Commonwealth Treasury modelling, all of our own indications in terms of our own economy, what we have seen in terms of consumer sentiment is that if you fail to control the virus, then the economy tanks anyway. So there is no world in which you can have the virus running rampant and think that economic activity is just going to be carrying along like normal. It tanks as well. People get nervous, people get sick, people get concerned. Once people are sick, it takes people out of the workforce, means that productivity falls. It's a downward spiral. You've got to maintain public health in order to maintain a strong economy. That's the whole point of the vaccination program as well.
Can you provide an indication of what kind of conditions will need to be met for schools to return in Term 4? And will the ACT government revisit the issue of mandatory vaccinations for school staff, or at least priority vaccinations for school staff?
Too early to speculate on all of that, but a clear indication for us in terms of coming out of lockdown is to get the number of cases infectious in the community down to 0 and consistently 0 for a run of days. Any other questions for me?
Census Elger has said that the ACT government has a moral responsibility to support the smaller construction businesses which have been unable to return to work. What do you make of that comment, and will the ACT government be extending specialised support to that sector?
Well, I was very pleased to be able to work with Treasurer Frydenberg in a constructive way to double the amount of assistance. So there's $20,000 grants available for those in that sector. And of course, we have announced today a pathway to restart activity in residential construction from the 10th of September.
Just a clarification on your non-organised recreation. Had some questions. Does that include golf or paddling on the lake?
Paddling on the lake, yes. Let me just check on golf.
Just with the vaccine delivery wrapping up at Garran now, will that then be reconverted back into a field hospital?
Most likely a testing centre first, but its original purpose, although it is multi-purpose, is indeed for it to be a surge centre should the need arise.
Do you see that need potentially occurring?
Well, not if the ACT gets to 95 to 100% vaccination, but if the country opens up at a level of vaccination that's too low, then yes, our hospitals will be swamped. So that's why we should not open up at a level of vaccination that is too low, which is why discussion of opening up at 70% needs to end now. That's just not going to happen. 80% is a more realistic target, and for the ACT, by the time the nation reaches 80, we hope to be at 90 or above.
And how are those discussions going with New South Wales about a greater Canberra bubble?
They continue. We are endeavouring to align our public health directions. We've now extended our lockdown beyond the current scheduled regional New South Wales one, although it would appear the situation in regional New South Wales, it's not for me to make this announcement, that's a decision for them, but it's not improving fast enough, you would think, for them to open up in a week, but that is entirely their decision.
Chief Minister, you're effectively looking after the health of Scott Morrison's public service. Has the Prime Minister thanked you or explicitly endorsed your lockdown approach?
I just swapped messages with the Prime Minister this morning just to obviously thank the Commonwealth for their support in terms of ongoing financial support. Well, I haven't had an explicit thanks in the exact terms that you've talked about, but you know, we do talk. We don't always agree. That's very clear, I think. But you know, we maintain a strong and effective channel of communication. We understand and respect each other's positions, but we will agree to disagree at times.
Given the number of cases we've seen in the past few days and the number infectious in the community, are you concerned that 0 cases is no longer possible for the ACT?
Look, that's not the epidemiological advice that we are receiving. It's, of course, very, very challenging. But we have a reproductive rate below 1, which does mean that with continued effective test, trace, isolate and quarantine, the effective public health measures that we put in place and an ever-increasing vaccination rate, that we're going to give it our best shot.
For the Chief Health Officer.
Okay, so no more for me. Terrific. Okay, thank you very much. Dr. Coleman will come up now.
The ACT went very hard with its lockdown restrictions early. It started off as a 1-week lockdown. It's now been extended twice. The reproductive rate is below 1. Does that mean the only thing left in the toolbox is time?
I think that's a great summary. We went for 1 week because at that point in time we had 1 case. We knew that it was very important to go quickly and very strongly based on what we had seen in other jurisdictions. At the end of 1 week, we had actually seen a massive number of exposure sites and cases were very much rolling through, so we knew we needed to extend. We think we have the settings right, which has allowed us to just give that little tiny bit of relaxation for people, for our mental and our own well-being. But we need more time. It's what I think you might have heard Dr. Kerry Chant talking about, mopping up all of the cases. We need now to really chase down all those chains of transmission, getting to those really supporting those high-risk and vulnerable groups. I'm confident in time that we will get to a point where our case numbers will be lower and we will be able to keep them low.
How confident are you that we are catching all the cases that are out there? Obviously, our testing numbers have really dropped off. How many cases could be out there that we simply don't know about?
I mean, that's the question, isn't it? I think there's always going to be those known unknowns in this kind of situation. When you say dropping off testing rates, that's true in terms of the massive surge that we had when we first had our outbreak, but our testing numbers remain 2 to 3 times over the maximum number we ever saw before this outbreak. So I think that while we would like to see testing numbers remain higher, they are still really, really high compared to what our normal baseline is. I don't know how many cases are out there. I don't think there's hundreds and thousands of cases out there, but I do know that there are cases that we haven't picked up because there are people who we don't know where the source of transmission comes from, and there are chains of transmission continuing to go on.
And if you continue to see testing numbers above 3,000, will you be satisfied with that level? Is that kind of your benchmark?
Yeah, I think 3,000, 3,500 at this point in time is probably what we would like to see. We don't want the same people to go and get testing all the time to artificially bring those up. it's really important too that the right people are being tested, and I think that's why it's so important for people to be aware of any symptoms and don't think that you do or you don't. If you think you've got symptoms, go and get tested and we'll pick it up early and monitor those exposure sites.
For the Health Minister?
Oh, I still got a few more for you.
Any update on the COVID case who visited Sutton last week, and do you know if the case in Googong has been linked to the ACT at all?
So the case in Googong is new and our investigations are continuing on that space, and I don't have anything more about the Sutton situation.
Can you provide an age breakdown or at least an age range of the people who are currently in hospital?
I was able to provide that a couple of days ago. I don't think I have it with me today, but what we're hoping to do for you tomorrow is talk a little bit about all of our hospitalised cases as part of this outbreak. So if you can bear with me, I can give you a bit more information on that tomorrow.
Is anyone in hospital a child?
No, we have no children in hospital.
We're nearing the end of winter, hooray, spring tomorrow. Does that give you any confidence as far as transmission goes?
It's good news. I had forgotten that spring started tomorrow, and I'm aware it's going to be a nice sunny day, so that will be good. Look, I think the thing that spring brings is hopefully it will assist our well-being. We always feel a little bit better when the sun comes out, and with this combined opportunity of spending 2 hours outside, I encourage everyone to make the most of that. And I think it will be more about just keeping our mental health and well-being increasing.
Ainsley Village, can you confirm that all 3 of those positive cases are in quarantine and have been since they were confirmed as positive?
So we know that the first case, which was unknowingly visited Ainsley Village while infectious, is currently now in isolation. One of the 2 cases is confirmed as being in isolation. We are still investigating the 3rd case.
What does that mean exactly?
It means that we are working to find and talk to that 3rd case.
Is there the possibility that that person is in the community at the moment, despite having been a positive confirmed case?
So we haven't been able to notify this person that they are a positive case. So since the time that they have had the test taken to this point in time, we have not been able to find them again.
How much of a risk does that pose to the rest of the community?
So I don't think we should overplay this. I think this is certainly a risk, just as is anyone who is infectious in the community a risk. But it is one case, and we are doing everything we can to try and find this person from their own health and wellbeing as well as the community's.
Is this part of the explanation for why Ainsley Village as an exposure site was expanded to include the entire site of Argyle House?
So as we've talked about before, when we have transmission on a site, that's when we upgrade that from being a casual site to a close contact site. So that is exactly what happened at Ainsley Village. On the first pass and the first risk assessment, we actually were hoping that it would only be a casual contact site because the risk of transmission was quite localised. After we had done testing of all residents and we identified these 2 additional cases, it became clear to us that there had been transmission on site, so therefore we need to consider the whole site as being a close contact site.
And can you confirm that there have been no additional positive cases connected to Condamine Court?
As far as I'm aware, we have had no additional cases come out of Condamine Court.
I just wanted to give you an opportunity to give a shout out to all our health workers who are on the front line. This is relentless for us as Canberrans, but certainly for them as well. How critical is the role that they play and how grateful are you?
Oh, look, there are so many people conducting so many different roles in this response. So in addition to all our frontline healthcare workers and our frontline public health staff, the number of people who have come in who have very little experience in health but have some amazing skills that we are using and they are willing to come in and learn and be involved is fantastic. So thank you for the opportunity to just say and remind thank you. And if we can all remember to be kind to these people, even when you're a little bit frustrated, we're all just here trying to do the best that we can, and let's keep going as a community. Thank you.
Minister, are you able to provide an update on the total number of ICU beds available in the ACT, whether that's been increased since the pandemic began, and how many of those beds are in use in the ACT, including COVID patients and non-COVID patients?
No, I'm not able to provide those numbers. If I'd been given a bit of advance notice that the question was coming, I probably would have had those numbers with me. What we have talked about during last year, when we were seeing that first wave of pandemic, was the work that was done in the ACT and across the country to triple the capacity, the potential ICU capacity and the potential capacity to support patients with ventilation requirements right across our hospital system. So that work hasn't gone away, that is still there. The planning right across our public and private hospital system to ensure that we can expand both our intensive care capacity but also our emergency capacity, our ward capacity. All of that work has continued, all of that work has bedded down, and in fact Cabinet is being briefed this afternoon in relation to the steps in that process around Flex, which is the first stage of expansion of capacity, Surge and Super Surge. So we have a stepped plan to increase capacity that takes into account all of the capacity right across our public and our private hospital systems. As has previously been indicated, in terms of the current number of patients in the intensive care unit at Canberra Hospital, there are 3 patients, one of whom is ventilated. COVID patients, that is.
Minister, from contact tracers to vaccinations to testing numbers, how many people are involved in this frontline COVID response?
Look, that number changes every single day, but there are hundreds of people involved in the contact tracing, in the testing, in the vaccination, in those jobs that people think of as frontline, in answering our phones. But there are thousands of people involved in the response to this pandemic, and that includes not just ACT public servants, but our community sector partners as well, and of course those self-organised groups in the community who are providing support to people who are in quarantine or who are unable to get what they need as a result of the lockdown. So I want to thank all of those people. I do particularly want to provide a shout out to those people who are answering the phones here in the building, who are supporting the ACT Health phone line and the vaccination phone line, but particularly those who've been answering calls from people who've been in quarantine. We know there's been a lot of frustration. We know there's been long waits, but the team answering the phones have been absolutely astonishing, and that's a combination of our paid staff and volunteers, and I particularly want to thank all of the volunteers across that effort. But I also want to thank the people who have been calling up, despite the frustration, despite some of the long waits. I'm told that when people actually get that call back or they get to talk to someone on the phone, most people are just really grateful and thankful for the incredible amount of hard work that is going on to respond to this outbreak as part of the global pandemic.
And how much support are those workers getting, given that they're probably having the busiest time in their career?
Yeah, there is a lot of work that's done right across the ACT public service, but particularly here in the building to support the health and wellbeing of our workforce, to understand that many people are working very long hours, and it is quite a stressful situation. There's a lot of unknowns out there. There's a lot of things that are happening and changing every day throughout this outbreak response. And so supporting the mental health and wellbeing of our staff is really critically important, and that's something that the senior leadership is paying a lot of attention to.
Recent statistics have come out about an increase in mental distress and self-harm during lockdowns. What statistics or recording is ACT Health doing?
Yeah, look, I don't have any numbers in relation to that, but I know that certainly right throughout the pandemic, after the initially we didn't see that increase at the beginning of last year in mental health presentations, but since restrictions started being put in place, we have seen increases in mental health presentations at our hospitals, feedback from our community partners that they are also seeing not just increased numbers but higher levels of distress among some of the cohorts of people that they support. That's why Minister Davidson today is making an announcement around increased mental health supports right across our community and increased funding for a number of our community partners who work with specific cohorts to provide that mental health support that's needed right across our community. community, whether that is young people, whether that is people from culturally and linguistically diverse backgrounds. Right across our community, those specialised services are receiving extra support from the ACT government to recognise the very important work that they do and the increased capacity that they require at this time. Great, thank you.